Well, I'm seeing like Jeff Bezos on his yacht with his girlfriend and like
I know, he's looking good.
I mean, what is he
looked
doing?
better. He looks
He's
better
like-
now than he did like before.
He's just like drinking the anti-aging serums
Or
and
injecting the
potions.
anti-aging serum. Aging in reverse. Is it too good to be true? We're going to take a deep dive into the world of regenerative medicine, looking at treatments, technologies that help turn back the hands of time. I'm Dr. Azi and Nurse Lacie, a board-certified dermatologist, which basically means I help people feel confident in the best version of their skin.
And I'm Nurse Lacie, Dr. Azi's right-hand man.
Yes, she keeps me out of trouble
I try.
and on track.
Yes.
First of all, look at where we're sitting.
It's so
Can you guys
cute.
believe that? I'm so excited about this new set. I feel like we have a TV show, like
I
a
know.
full-on TV production. I don't know what I got myself into, but this is phenomenal. It's so professional.
Mm-hmm. Remember years ago when you were like, let's start a podcast? And I was like, no. And
I was
in your
and I was like,
office.
what's a pod? No, this is how it went, guys. I said, what's a podcast? And you go, oh no.
No,
No,
don't even consider
you don't
it.
you don't have time. And I was like, well, I think it's really cool. I think you just sit around in a room and you talk and you have like guests on it. And I was so excited about it.
Look at you now.
I know. What happened? I'm so excited to be in this beautiful new set. We want to really thank you guys for your support and listenership throughout the years in helping us achieve this, being in
Yes.
this beautiful set. So we are forever grateful to you guys.
Yes, thank you.
If you're just listening, check us out on YouTube where you can see the new set that we're talking about.
You don't want to miss it.
So if you're new, we always go through a beauty and blemish where we talk about the best things happening in our life and the not so great things we just wish we could take a concealer and erase.
Yes, so I'm just going to start. I have a blemish.
What's your
And
blemish?
As you know, I was out last week for surgery.
Yes, that was so hard. Don't
Sorry.
do that again.
I had, as you guys know, or if you're new, I suffer for endometriosis for a long time. And I went in to have just a routine laparoscopic procedure where they just clean all the endometriosis out. But I actually had a lot of scar tissue instead and
wow.
found out that my fallopian tubes are scarred. So I
Oh,
can't
no.
have any more children naturally. But we're here today to talk about regenerative medicine. And so I'm super excited for my post-op appointment, see if maybe there's anything that I can go over with my doctor to see.
That's right, to regenerate some of that tissue.
Yeah.
Well, the beauty of not being able to have any more children, I guess, is that you'll be wealthier
Yeah.
and look younger and
Well, I look at it as no more emotional roller coaster, right? As
Yeah.
a woman, we carry a lot of emotional and mental weight as to like every month, oh my gosh, could I be pregnant? Oh my gosh, my period's a day late, or oh, I'm having breast pain. Am I pregnant?
Yeah.
And so
well,
I
yeah,
have-
children, they take a lot out of you.
They do.
Yeah.
Yes, they do.
Well, you have Remy, so
Yes,
that's good.
I'm so thankful. Yeah.
Well, my blemish is, I had a patient when you were out last week and she came in and she had already been to several dermatologists and she had these nodules that unfortunately my heart broke for her. She was almost disfigured by these nodules, these lumps in her skin that have been going on for 10 years.
Wow.
She's had these lumps that were causing her so much distress. And I was like, what did you do? Like, what did you have? And she said about 12 years ago, she went to a beauty salon.
No, stop.
And had injections to help lift her cheeks and help with her lips and help with her smile lines. And she had a couple of sessions of these injections. She says, everything was fine for like a year or so. But it was after about a year that she started developing these red, tender
Oh my goodness.
knots under her skin. And it just gotten progressively worse. She's already been to a couple of dermatologists and, no one's really been able to help her. I was just shocked. One, that, you would get injections, in a beauty salon, but everybody makes mistakes. And honestly, it's so hard to know for the average consumer who is truly professional and who is not, because a lot of people will just set up shop, call themselves a experienced expert injector and inject all sorts of things. And they may be giving you a great deal, right? So you may be paying a fraction of the cost of what it would cost to go to, for example, a plastic surgeon or a dermatologist. But these are the real life complications that could potentially happen. I'm assuming that it was a foreign material that they were injecting, or it could have been a hyaluronic acid with some sort of impurity. It's so important to make sure that the fillers that you are putting into your face are, one, FDA approved, that they are sterile, and the person injecting has the medical training, because these are, at the end of the day, they are not beauty treatments you could just get done in a salon.
It's medicine, and people forget that.
That's right. Yeah, fillers are like implants, and implants into the skin can have a lot of risk, meaning your skin cells are naturally there to protect you against foreign objects, protect you against infections, and all sorts of things, or intruders into the skin. And so what happened was there was some impurity or something that got in below her skin, and now her immune system was gathering around this foreign substance, building a mound essentially to try to dissolve it. You see the same type of reaction in leprosy, which is caused by a microorganism. So she looked like a leprosy patient, unfortunately, but it was all due to a cosmetic filler. So I get this question a lot, where you should look and what you should do to find somebody reputable. It's really important to look for somebody who's board certified dermatologist. So you can check out the American Society of Dermatologic Surgeons or the American Board of Plastic Surgery. That's a great place to start. Now, a lot of times they may have nurse injectors. It may not actually be the doctor, but at least it comes from a reputable office.
All right, before we get into it, you guys, don't forget to rate, review, and subscribe. It's your support and listenership that keeps our podcast going.
Okay, hold up. So before we get into regenerative medicine, let's look at what happens to the face as we age, because there's a lot of changes. For one, you can think of your face like your bed. Okay.
Yeah. Like your bed?
Like your bed.
Can you elaborate on that? Because I don't think of my face as a bed. Do you guys? I don't know.
So your bed has a framework, right? You can think of that as your bone structure in your face. And as we age, we lose bone. Everyone always thinks we just lose collagen, but no, we do lose bone. The bony orbit around the eyes starts to get wider and wider due to bone loss. You lose support. That's why your eyes look smaller. And then our maxillary bone here tends to resorb, so it's not holding up our cheek fat as plumply as it used to. And then the jawline starts to regress back, and the bone structure pushes forward because the jawline becomes more obtuse in its angle. So it doesn't have as tight of an angle as it used to. Therefore, you don't get as much of a, straight or, defined jawline. And that's when you start to see the fat kind of lose support. So you start to see the jowls, you start to see these deep folds start happening. So you can think of that as the framework of your bed. Now, the mattress is like the fat, the muscle tone. We also tend to lose fat cells, and particularly around the temples, brows, in the medial cheek and lateral cheek area. And again, that's kind of like what holds the mattress kind of plump and cushiony. And then the seams of the mattress, wait, I'm not done yet. The seams of the mattress are like the ligaments that holds the fat together, and they get stretched with time. And lastly, the skin is like the sheets that go over the bed, right? So the sheets are like the drapings, your comforter, your sheets, what go over the bed, and they
get wrinkled.
And that's true. Due to loss of collagen, elastin, hyaluronic acid, the fabric is you just get more fabric that gets stretched. So there's a lot of changes that are happening. So think of your bed when you're thinking about your face and all the changes that are happening.
Okay. I'm going to call Kentucky.
I thought that was a really nice analogy.
It was great. I don't know. I think we should just dive right in and tell us what is regenerative medicine.
So it's exactly what it sounds. We are regenerating human tissue. So we're applying treatments to restore function or goods that have been lost from the aging process or from an injury. Essentially, you're helping the body reform some of these systems to recreate cells, to rebuild tissue and organs. It's a hot topic right now.
It really is.
I see a lot of people talking about it. Everyone is chasing the fountain of youth,
yes,
that holy grail. But you have to understand that it's not just collagen. We gotta support your bone, your volume, your fat. And when you understand what's happening in the aging phase, it'll make more sense when I tell you about treatments that can reverse aging.
Okay, well, I'm gonna ask a question. I know everyone wants to know. What are some examples?
Well, a common example that's really popular in my office is PRP, which stands for platelet-rich plasma.
Liquid gold.
Liquid gold, or it could be platelet-rich fibrin. So what that entails is you come into the office, we take your blood, and then we spin it down in a centrifuge, and we extract out the plasma that has all these growth factors and mesenchymal cells, and then we use it to it's full of growth factors. And
you said mesenchymal cells?
Oh, mesenchymal cells, yeah.
That's a first.
Some cells, we inject that back into your face. It's very Vampire Diaries here. Or we use it after treatments like laser resurfacing, where your skin is open and it's able to receive these growth factors, and that helps regenerate collagen. Or wounds. We do it for, when we just did somebody who had a melanoma resected and he had a wound down to the bone, and we are regenerating his skin, and we used it to help regenerate tissue to fill in that hole that he has in his head.
Pretty amazing.
Yeah. So we could do a lot of amazing things, not just for, aging, but also just scars and wounds and tissue regeneration. Aren't you curious?
Okay, so
don't you want to know?
Yeah, I do. I really, really want to know what the difference of PRP and PRF is.
Well, PRP is liquid. You said liquid gold.
Yeah.
PRF is solid. The difference is how it's processed. So PRF, we spin it down in a centrifuge much slower, whereas PRP, we spin it really fast, right? So we get more of that liquid, whereas PRF is almost termed as the natural filler now. But it's tricky. You have to inject it right away, or otherwise it gets too hard and then it becomes too solid.
Okay, well, I need to know, because I thought that it was still liquid.
No.
But you had the option of mixing it with something that turned it into a gel.
True. Yeah, that is true. So you do have this sort of biocellulose matrix that you mix in with the PRF, and then it becomes this solid, almost like a filler. And then you can inject it into the face or wherever you want to regenerate tissue. And the studies show that the growth factors in PRF tend to be released over a much longer period of time, so over a week or 10 days, whereas PRP, they almost get released instantly. Okay. So that's sort of the difference where PRF has an advantage.
Nice. Okay. I learned something
so
new.
It's the easy gel that you're talking about that you mix in with the fibrin. Yeah.
Okay. Well, what about exosomes? Because I hear a lot about that.
Yeah, so exosomes, we used to think they were trash, but now
I didn't want to quote you, but I mean, I do remember a couple episodes back, maybe.
But now we know they're actually treasures, and they could play a really important role in tissue regeneration, collagen stimulation. But you should know they are illegal to inject in the United States because the FDA is not convinced that we have the safety standards down. There's been reports of people developing tumors when exosomes have actually been injected into the skin or the scalp. So really, we can use them as topicals after a laser resurfacing or microneedling when your skin is open and it can receive the exosomes. You can think of them as these little vesicles, these little bubbles that carry cargo. So they carry proteins and lipids, and they're essentially like messenger cells between your between your skin cells or your bone cells. And so they help cells communicate with one another in regenerating tissue. So similar to stem cells, but they play a little bit of a different role.
How? How are they different? Because I guess for me, I always thought it was kind of the same thing. Like exosomes were like man-made stem cells.
So
almost.
Is
that weird?
Exosomes are
idiot?
kind of like the telephone, between cells.
Uh-huh.
They're sort of the communication between cells, which is important in tissue regeneration. Whereas stem cells, they are the mother cells. Did you know that the term stem cell first appeared in literature in 1860? That's so long ago.
I did not know that. That is a very, very long time ago.
Yeah, in an attempt by Darwin to explain evolution.
Whoa. Okay.
So stem cells are the creator of cells. They have the potential to develop into any organ. So you can have a stem cell develop into bone, fat, skin, all kinds of organs. So they are the progenitor cells.
I feel like I just had biology all over again.
And physiology.
Yeah. I love learning so much from you.
I know. I feel like I've been a professor this episode.
Yeah. Well, I'm seeing like Jeff Bezos on his yacht with his girlfriend and like
I know, he's looking good.
I mean, what is he doing?
Better. He looks better
like,
now than he did like before.
He's just like drinking the anti-aging serums
or injecting
potions.
The anti-aging serum.
Tell us more. Where can I get that?
So the word on the street, is,
give me the gossip. Give me the gossip.
Is using human growth hormone injection. Is he using it? I don't know. I'm not his doctor, and this is just speculation for educational purposes. But human growth hormone has been shown to decrease with age, and some people do become deficient in it. So maybe he was deficient.
Because wasn't he like balding too? I don't know. Don't quote me. But
well, that's a whole other. That could be. Well, maybe he's doing steroids. I mean,
testosterone. Keep doing what you're doing, Jeff.
Well, growth hormone helps you gain more muscle mass, gives you better exercise capacity, helps with bone density. As teenagers go through their growth spurt, it's the growth hormone that makes their bones grow and makes you grow and develop. It helps with body fat reduction and helps with peptides for collagen stimulation. There's all these potential benefits. But guys, it could also cause diabetes.
Oh, I was gonna say. That's not what we want.
So it could definitely backfire.
But
there's
it's all
these
in moderation,
things.
Right?
It depends if you really truly need growth hormone, but I would be cautious in just doing it for anti-aging because you could develop a whole host of other problems. A lot of these anti-aging injections that are deemed to be the latest and greatest thing, these infusions people do, later on we see research that comes out that actually accelerates aging.
Yeah, that's what's so scary about new things.
Yeah, you really have to be careful. You want to go to a legitimate doctor that really understands the science and just doesn't just push these infusions and injections on you personally.
Well, I want to know what other hormones people are using to reverse age. Because, look at Cher.
Yeah, she looks phenomenal.
Jennifer Aniston, I want to age like her. Who else? J-Lo and Beckinsale. What's her name?
Kate Beckinsale.
Oh
my God, I love her. She looks like she's
gorgeous.
30. She looks phenomenal.
Can I get what they're having? Can you just help a sister out, please?
Well, I'm glad you brought up some phenomenal women because they do look smashing for their age. I mean, they look good.
They didn't even age.
Some of them look better than they did back in the day.
Seriously.
I think J-Lo, she looks so much better than she did when she was in her 20s. And Cher is just frozen in time.
Yeah.
She has this hot new boyfriend too that's half her age. Dude, she is goals. I think a big component is estrogen. Honestly, I think a lot of women are really not talking about perimenopause and the decline in estrogen that happens with our body. Starting in our mid to late 30s, you start to see a decline in estrogen as our ovaries start to burn out. And estrogen is so important for your bones, for your collagen, for your fat and muscle tone. Remember the bed analogy? We got to think of the bed as
the mattress.
We got to think of the face as an entire bed. It's not just about collagen, but I think estrogen definitely helps preserve some of that youth that we see some of these women holding on to. And although it's very controversial and it's not right for everyone, but the studies that were done on estrogen years ago were done on synthetic estrogen and not on the bioidentical hormones that we have available now. And I'm so excited to have Dr. Marie Claire, upcoming episode this month. She is the expert. I'm going to stop talking about this because I feel like I don't have a place.
So
she's coming on, and she is a perimenopause and menopause expert that really knows and understands the hormones at play, because there are risks to taking it. We're going to go into more detail when she comes in, so stay tuned for that episode.
Okay. So if we don't want to inject ourselves with hormones, what can we do naturally?
Lacie, that is such a great question, because I feel like it gets overlooked. I don't think people realize how much lifestyle can impact their hormones, their overall health, and their skin, really. Yeah. There was actually a study, let me tell you,
And your studies, tell us.
That they took skin samples from people in their 40s that exercised 3 times a week and compared it to people that led mostly a sedentary life. And guess what?
Tell me.
The skin markers from the people that exercise regularly were comparable to those that were in their 20s and 30s.
No.
Yeah, so there is a theory that when you exercise, your muscles release these myokines, right? And these are just like hormones that communicate throughout your body. And there's real science to this, that it can help you generate younger looking skin and just healthier organs. And think about it. The blood flow, the oxygen delivery, and your skin sweating all that, toxins and stuff out of the pores. It has a lot of benefit. What about that post-workout glow that you get?
Yeah, it's true. And you just feel great.
You just feel good.
You do.
Stress reduction. And there's just so much at play. I mean, we know that stress is one of the worst things that could accelerate aging. You see people that grow like gray overnight or develop, wrinkles within 3 months after a stressful event. So exercise is really your ticket to all these things.
Yeah.
And not to mention your brain with forming new healthy brain cells.
I love that. I love it. But I mean, it's all in moderation, right? Because we have patients that are runners and, run marathons, and you see like volume loss.
Yeah, so their skin looks good. But if they had a dermatologist that would just replace the volume loss, you see where I'm going with this?
Yes. The bed frame.
The bed frame. The mattress may be deflated, but we can reinflate the mattress. But let me tell you, that comforter looks good. The sheets, they're looking good. The muscle tone,
Yeah.
So the
if you're watching, we have a fly, and the
And
wall just fell down.
That is a great start, guys.
Thanks for watching.
Thanks for watching. We're just getting our feet wet here.
Yeah.
Okay. All right. Loosen up, guys. Loosen up. Okay, here we go. So let's get back to dermatology. I feel like, I'm losing scope here. I'm definitely not a nutritionist or OBGYN or a hormone specialist.
But how does it tie in?
When I think of regenerative medicine, I think of like lasers, radiofrequency microneedling, biostimulatory injections.
You are obsessed.
Skin weave,
You are obsessed with lasers.
What?
You are obsessed.
Why does everybody keep saying that?
Yeah.
It's not an obsession. It's a passion.
It's a passion. Okay. It's a very strong passion.
I love laser resurfacing. And what that is, these are treatments like the Halo, the Profractional, Skin Lift Laser, Fraxel. You may have heard of them before. Essentially, we're taking off fractions of your skin and allowing your body and your skin to regenerate new healthy skin cells. It's almost like how reptiles lose their tail and then they regrow it back. Well, that's what happens with skin resurfacing. You essentially regrow back skin that we very carefully, now I want to say, when I say we just take off your skin, I mean we do it in a very controlled, systematic way to allow the regeneration of a new healthy skin. So it's not just, burning your skin off, even though it may look like it in the videos. There is much more science to it. We can control the depth, the density, the amount of heat that's delivered to the tissue, and customize that based on everybody's skin. Now, not everybody is a great candidate for laser resurfacing, right?
Like who?
If you have active conditions like acne, rosacea, you should really have those conditions under good control. And if you have darker skin, we really have to change laser resurfacing settings because you can have a higher risk of hyperpigmentation.
I would like to point out you emphasize darker skin, but you can be a lighter skin tone but have the ethnic background too, because we had this conversation. What brings this up for our listeners is we had a patient that was Middle Eastern and was like, I don't have dark skin. And so
it's the amount of melanin in your skin's potential to generate melanin.
Yes.
Right? So we call it melanin rich skin versus melanin poor. Like you're melanin poor and I'm melanin rich, which means that.
But like when you look at us, we're like the same.
Yeah, we're not. Yeah, but if I get a pimple, mine's going to turn dark and yours is going to turn red.
Yes.
And so it's different in that sense.
Yes.
But that's a whole other episode.
Okay.
So microneedling is when we use little tiny needles that go in and out of the skin, essentially causing an injury to the skin. And that gets your fibroblasts to reproduce collagen and elastin, and that's how it's regenerating, right? That's how microneedling works.
Yes.
And a lot of times we do add PRP, exosomes. You can think of that as like the fertilizer after
on
the
your
laser.
face.
Yeah, exactly.
I don't want to think of that like that.
Well, it's, the laser is the laser, but then like you add this growth factor, you're just feeding the ground.
We're feeding the ground.
Feeding the skin, the growth factors to regenerate even more collagen.
Fertilizer makes me think of shit on your face. I don't want to think that.
Like cow dumps?
Or chicken. I don't know.
Well, sometimes it smells like that. Have you guys... Let's get into the skincare because
you guys,
I have been using this human growth factor. This is a company. By the way, none of this is sponsored, right? They did send me this, and so I have been testing out. But
I was gonna ask when I saw this display. I was like, "Oh, do we have sponsors now?"
No, we don't have sponsors, but guys, sponsor us if it's only. But we'll only do it like if it's truly.
No, you guys know, like Dr. Azi literally has her genuine best interest. She talks about products that she genuinely cares about or doesn't.
I don't do a lot of sponsorships, but if I do, it's. But look, okay, back to this that smells like cow plumps.
And is this for us that don't have Bezos money? Like, are these, if we can't afford to do all these luxury treatments, is this an alternative for us, or are you going to tell us it's another $1,000 for this as well? Okay, talk nerdy to us. What is this product?
Okay, so this is expensive, all right? So because it has human stem cell factors and it smells like cow dumps. And I've been using this, and just smell it.
I don't want to smell it. Okay, let me.
Well, actually, it's not so bad. Maybe
I don't think it's that bad.
No, you just smell it now. It takes a while before it starts to.
Oh, yeah, that's not.
It smells biological.
That smells clinical.
So we have to be careful with stem cells. Do you know TNS, which was the original, the OG used growth factors and stem cells?
Obsessed.
Was in a lawsuit because they were using bovine or cows or human like blood in their products or something, and then the FDA said, well, we're not sure if this is going to cause tumors or not, so they had to change the formulation.
I thought it was just circumcision tissue, and now you're telling me there's cow blood in it too.
Okay,
I don't know that I
don't misquote me on that. Maybe it's circumcision tissue. Maybe it's some poor baby's, like, I don't know. Okay, just don't quote me on that.
Penile tissue for your face.
But the FDA is really cracking down on stem cells and regenerative medicine injections because of the fear of potentially these things could potentially cause tumors. We want the anti-aging, but we don't want to grow tumors and the risk.
No, give us all the good with no bad.
Okay, now smell it.
Okay. Oh, God.
It
yes.
takes a while. You smell it now?
Oh, that's horrible.
It smells really bad.
Oh,
But a lot of these, human growth factor products do smell like that. Another one is Biologique, which they haven't sent me any stuff, but that's another line.
I don't know that they are now.
So you
Tell us
asked
more.
what you can do at home. So that was, some of these products have regenerative potential. I love our Restore. This is what I use because it uses plant-based stem cells as opposed to human. Plus, it has things like resveratrol, which is anti-aging and helps promote collagen, green tea polyphenols. These antioxidants can really do a lot for the skin. Plus, it has peptides, which are the building block of collagen, and the plant-based stem cells we talked about.
I use it as well. It does not smell like dump at all. It smells very good.
Yeah, it
like
does. It's
oranges or something.
Yeah, it doesn't
I don't
have
know.
much of a smell.
I
But
think it smells
Jason
good.
Diamond sent me, you guys know who Jason Diamond is? He's a plastic surgeon, and he came out with this very expensive, it's called Metacine.
Metacine,
And
like the metaverse.
I thought that it comes out like
Oh,
this. It
it's
looks
red.
like blood, but it's not.
It looks like blood.
And it has a lot of peptides in it, but it's a whopping $510.
Whoa, what's special about it again?
I mean, Restore is what, 95? It has plant-based stem cells and peptides, and this has a lot of peptides because I looked at the ingredients. It does have like glycerin and peptides in it. So I'm not sure about splurging this much. I mean, you might as well get like an office treatment for $510.
Yeah.
And it's such a small bottle.
It's so tiny. How?
But,
Yeah, I don't know.
Thanks for sending this over.
I think I've learned so much at Dr. Azi's Derm Academy.
Other things you can do at home, good old Retin-A. You know I love Retin-A.
The superstar.
Superstar of your skincare regimen. It stimulates collagen, it protects your collagen, it boosts circulation. You will never meet a dermatologist that is not on a retinoid.
This is true.
Yeah.
Or anyone in the skincare industry, right?
Yeah,
if you know your skin.
Aside from sunscreen, put on your Retin-A. You can get pretty equal results. When we see studies looking at before and afters of lines around the eyes that people use Retin-A for, oh my goodness. It looks like they had a procedure.
Yeah.
So if you don't have Jeff Bezos money, these are some things you can do at home.
I will say too, I've had patients that maybe didn't tolerate a prescription grade Retin-A, but really do well with the Lift and Renew.
Yeah, I love the Lift and Renew. We actually did studies on Lift and Renew, and it showed it's just as effective as prescription Retin-A, but without the irritation.
Yes.
So for more on retinols, check out my YouTube video called Retinol 101. I think it's time for you to graduate, honestly.
For me to graduate or
To
our
graduate
listeners.
to answering our listeners' questions, which is your favorite part.
I see what you did there. You guys, it's my favorite part. It really is. I love getting these questions from you guys.
We love hearing from you.
Yes. All right, we're going to do our first question today. And you guys don't forget, you can always email us or DM us. Email morethanaprettyfacepodcast@gmail.com. Again, we want to hear your questions. Our first question's from Mandy Edwards. She says, "Hi, Dr. Shirazi. I'm obsessed with the podcast. Thank you for the educational content. Which treatments will give me the biggest bang for my buck? I'm in my late 30s and have lost some weight and noticing a lot of skin laxity, marionette lines, and jowls. Please tell me, which procedure should I look into?"
Well, starting in our early to mid 30s, when we start to see loss of volume, this becomes really evident by the time you're in your late 30s. And one of my favorite treatments to restore lost volume from a globally is using Sculptra.
Oh, we have it.
We have it, yeah. So Sculptra is great for somebody who is a runner, has been losing a lot of weight in their face, and they just want to build some volume up, and it helps tighten the skin, just gives your skin a nice glow. You can always come back and fine tune it with fillers here and there, depending on your volume loss. But I love Sculptra, which is a biostimulator. And you can see here, it's a powder that we mix in with water. We inject it into the face. and your body starts to form collagen fibers around these little particles. And then eventually the particles get absorbed by your body, and what's left is the collagen matrix that it makes. And that collagen builds volume and helps with firming the skin. Now, you have to be careful because you don't want to do too much of it. I would suggest up to 5 sessions before you start to get too firm and too tight and too much scar tissue underneath the skin.
Is that one vial per session, or?
It depends. I mean, it depends on how much volume you need. You can do half a vial per side, so one vial total. Some people will do 2 or 3 vials. And so it depends on, your loss of volume. But I love it for the temples, for the cheeks. You just have to be careful. Don't put it around your eyes or around your mouth, because one of the risks with Sculptra is formation of nodules. Now, a lot of times you can't see the nodules, you can just feel them. But for the most part, it's important to massage the area 5 times a day for 5 days, 5 minutes at a time, to help prevent the clumping of the product so that you get a nice, even distribution of volume.
Yeah. I have a question from Isabel, and she asks, what are your thoughts on Profhilo? What?
Profhilo.
Profhilo.
I don't know. It's actually not Profhilo. It's called SkinVive, people. SkinVive.
Oh, okay. So this is known as SkinVive.
Yes, it's the first filler of its kind that's just been FDA approved. We have it in our office, and I'm so excited about it. It's a dermal filler that changes the appearance of your skin, but doesn't actually add any volume to your face. And so your dermatologist would inject it in little tiny micro droplets on the surface of the skin to give you that hydrated glass skin that we see trending all over social.
Yes. How does it not create volume?
Yeah, that's a really good question. So I'm back to my analogies. The traditional dermal filler. So I actually have one right here.
What do you have?
So this is a dermal filler. This is Restylane Kiss. So let's look at it. If you think of hyaluronic acid as spaghetti, you like spaghetti?
Yeah, I love it.
Okay, spaghetti strands, they help attract and hold on to water.
Yes.
But there are different types of spaghetti. So if you take the spaghetti and you cook it a little bit more, what happens? It starts to clump together, right? And that is what a volumizing filler would do. So this is spaghetti that's been cooked, right? So it clumps together, and this is the kind of filler that will add volume to the face. But SkinVive is a different type of spaghetti that hasn't been cooked as much. So it tends to stay as single strands. And when you place it into the skin, it sort of just diffuses out and doesn't clump together and give you volume or change the shape of your face. It's purely only for hydration. So I love it. I think it's a game changer. It lasts maybe 6 months to a year. Now, it is very new, so we don't have a lot of experience with it quite yet. But we're so excited to have it in our practice.
Yeah, I was just going to say that.
It just gives your skin that dewy, glowy appearance. Like you just...
what we're all craving.
Yeah, like you just slept for 15 hours and just hydrated. Woke up like a dewy morning's glow.
All right, our next question comes from someone who wants to remain anonymous. They say, hi, Dr. Shirazi. I'm coming off of radiation and chemo and lost a good majority of my hair. I've been in remission for 18 months, and when I look in the mirror, all I can see is myself looking sick. I've tried hair gummies, the oils, and Rogaine, and I want to try PRP, but I'm so scared. It looks so painful. What would you recommend to regrow my hair?
Oh, I feel for you. Losing hair is so emotional. And I know exactly how you're feeling. I've struggled with hair loss in the past, but the good news is hair is so regenerative, which means that we can really get it to regrow back. We just have to form the optimal environment for it to help it grow.
And have patience.
And have patience. But sometimes you're faced with genetic factors which you cannot control that can affect how your hair follicles age. Some people have that amazing hair gene where they can just grow hair and I mean up until their 80s and 90s. And other people unfortunately will experience something called female pattern hair loss or male pattern baldness. That is when your genetics tells your hair follicles you need to start shrinking, so your hair follicles start this miniaturization process, and eventually those hair follicles go away. So you want to catch it in that stage before the hair follicles go away. Now, what you're talking about sounds like maybe telogen effluvium. It sounds like you just went through a really, period of time when your body was under stress. You're going through chemo and all those things. And if you feel like you haven't regenerated some of that lost hair, then I have some suggestions for you. Number one, make sure everything on the inside is doing well. I'm so glad to hear that you're in remission,
Yes.
but you need to get your iron levels checked, your vitamin D, your iron protein, which is called ferritin, your thyroid, all these things. We want to make sure they are at an optimal level. And it's great that you started on Rogaine, which is minoxidil, and that is a hair stimulator. So it changes your hair follicle's destiny. So remember I was telling you they get miniaturized? Well, it reverses that miniaturization.
I like
So
how
the
you said that.
Rogaine, yeah, so
Changes your destiny.
it changes the destiny of your hair follicles to ones that keep growing. So Rogaine not only stimulates more hair follicles to enter the growing cycle, but it also keeps your hairs in the growing cycle longer, which means longer hair. Have you noticed as you age, your hair doesn't grow as long?
Yes.
I mean, in some people, Rogaine will help it stay longer in the growing phase. You can also take Rogaine by mouth. So there's a pill called minoxidil. Now, there are other medications such as finasteride and dutasteride, as well as spironolactone. They all work a little bit differently in that this class of medication actually blocks the male dominant hormones, the androgens, from affecting the hair follicles, because that is one of the key factors in that miniaturization.
I have a question. Would you take all three of those? And when you say it stops the male, would men be able to take these as well?
Well, men shouldn't take spironolactone because it grows boobs.
True. This is
Breasts.
true.
Yeah,
Yes,
it gives you
yes,
breast tissue.
yes. That's the
Which is
magic pill for women.
That's right.
Mhm,
And
yes.
women, it promotes scalp hair, it makes your breasts fuller, it reduces facial hair. But in men, you probably don't want that as a side effect.
Yes.
But in men,
Or you do.
Propecia.
And if you do, that's great too.
That's true. In Propecia helps. It's finasteride, and then there's dutasteride, which is a newer version that's even more specific for stimulating hair. Helps really with the frontal hairline, whereas minoxidil stimulates hair everywhere.
Oh.
So the combination of those two is great. Now, let's say you don't want to take finasteride or dutasteride because there are sexual side effects, which is lowered libido or erectile dysfunction. Then you can get it in a solution, which we have in the office. This is called Hair Restore, and this is minoxidil 7%. So this is prescription. It's going to be much higher than Rogaine, which comes as high as 5%. But it also has finasteride in it, so you don't have to take it by mouth. You can just put it on the scalp, and it has an effect. So this is once a day, whereas Rogaine is twice a day.
It wouldn't affect your libido.
It would not. I mean, it'd be very difficult because, again, it's not going into your body. It's just going application wise on the surface of the skin. So there are other natural therapies like rosemary oil, which is having its heyday right now. Everyone's using it to grow hair. You do have to use that twice a day in order for it to be effective.
Would you get itchy from it? I feel like rosemary oil would make you like
it can.
irritated.
Some people do get a reaction, but you can also have itching from Rogaine too, just because it has propylene glycol in it, which allows it to absorb better. So it can also cause irritation. And then lastly, I recommend patients start on a shampoo called Nizoral, which the generic is ketoconazole. That's actually been shown to be potentially a DHT blocker, which again helps with that miniaturization of the hairs. Plus, it reduces inflammation. So a lot of us have yeast on our scalp that promotes inflammation. So Nizoral helps reduce that inflammation. So it's not a bad thing to wash your scalp with that. And lastly, there are these laser caps. Have you seen them?
I have seen some funny looking pictures of people with the caps on, and I
Yeah.
just don't know if it's worth it.
So it's low level light, which is shown to stimulate hair growth.
Uh-huh.
One of the reasons why laser hair removal can paradoxically stimulate hair on your face.
Mm.
But that's a whole other subject.
A whole nother
Sorry.
episode.
You need to say Kentucky at this point.
Okay, yeah, Kentucky.
So that's something you can do at home. Now, what about in office treatments? PRP, you're scared about doing PRP because of the pain, and I totally get it. In our office, we use a vibration technique that really helps minimize the pain. We also use a instrument called a mesoram, which is a circular device. It has multiple needles that go into the skin all at once, but the beauty of it is you only feel one needle while you cover a large area at a time. So
Patients love that.
Patients love it. It goes by so fast. Before they can say ow, it's like done.
Yeah.
Plus, we have nitrous oxide gas, which is Pronox.
Our favorite.
And that sort of just it's a breathable anesthetic. What I love about it is you can drive home.
Yeah. It's like having a couple martinis, but still being okay to drive after a few minutes.
Yeah, because it's a gas, so it wears off. It leaves your system within minutes. So if you're watching this, I want you to know hair is regenerative, and we can bring some of that hair back.
Yeah.
So see your dermatologist, get on a plan. You don't want to wait too long and try to salvage as many hair follicles as possible.
All right. Are you ready for Save and Splurge?
I'm so ready to save and splurge.
We want to hear what you would spend your money on or not really.
Let's do it.
Okay, I'm going to ask you a list of questions. You say save or splurge.
Got it. I'm ready.
PRP for hair loss.
Splurge.
Yes. At-home derma roller.
Save your money. Can I explain why?
Yes, please. I guess I'll give you a few seconds.
Okay, I'm not a fan of derma rollers in general for two reasons. One, especially at home. One is the needles enter your skin at an angle as opposed to the stamping mechanism that go into the skin at a 90-degree angle. And so with derma rollers, there's a greater risk of tears in the skin as opposed to the stamping microneedling. Plus, the derma rollers at home, after the first or second use, the needle's dull and you can get infections and they can grow things. So I would say save.
Gross, yes. Skincare with exosomes.
Splurge, but there's technically, it may not absorb. I'm confused. I don't know.
Okay,
it's so new.
Halo laser.
Splurge. I love the halo.
You do. You really do love it.
And new study shows that it can actually reduce incidence of skin cancer. So I'm really excited about that for my patients.
Oh, that's awesome.
If you've got precancer, halo laser does such a great job with those scaly red spots.
Yes. All right. Peptides for anti-aging.
Splurge, or should I say splurge?
What?
Depends on the peptides. I mean, I feel like people throw like peptides around. Well, maybe you shouldn't spend $510. Maybe you should spend like $100. But like, you know. Splurge. Yeah.
I like that. PDO threads.
Ooh. If it's done the right way, you know, if you have thin skin, stay away from it. It's temporary.
See a professional.
I do them, but I'm very select patients.
Yes. Sculptra.
And the right patient when it's done right. Splurge.
Swapping blood with your child.
Ooh, what?
Where
did that come from?
Haven't you seen that guy that's
what
like
guy?
really big in social media? He's like he's aging backwards and reverse.
He's really pale.
Yeah.
I feel like he needs some sun.
Yeah.
I mean, I know I'm a dermatologist, but
everything in moderation.
I think he should get his vitamin D levels checked.
I mean, yeah. That's a
and maybe some fat or some Sculptra.
All right.
Okay.
Well, thank you,
you guys. Thank you for tuning in to another great episode of More Than a Pretty Face podcast. We are so appreciative of your listenership and support. It's all because of you guys that we keep doing these episodes. Don't forget to follow us on Instagram at More Than a Pretty Face podcast. And we're on YouTube, so check us out. Check out our new set because it's so cool. It's so pretty.
We're super pumped about it.
And guys, we just launched a TikTok.
Oh my gosh, I forgot about that.
So Follow us if you want to see little highlights and clips from the episodes. You can watch them on TikTok and Instagram Reels.
Yes.
Thank you guys for tuning in. Don't forget to rate, review, and subscribe. Share this with a friend because sharing is caring. Comment below. Let me know what you want to hear about next. And if you have any questions about any of the treatments we just talked about.
Bye.
Bye, guys. Or whether it was, or to just, never mind. Just cut that out. You did a good job with that. Visit the, there's a fly in here.
And answering more. Okay, let me try that one more time.